We rolling? Good. Well, good afternoon. An update on the cruise ship situation, both the Rotterdam and the Zaandam. The Broward County government officials, the Broward Sheriff's Office, the Coast Guard, and we've been in communication with the Coast Guard as well, and the White House have been working on a real, I think, thoughtful plan. I think that is a plan that's going to work and be approved. Just so people understand, there's probably 25 of these ships out there. Two of them, these two, have U.S. citizens on board. I think the Zaandam has, 40, 50 Floridians. So I think we have an interest in making sure those folks come safely. Some of these other ships are all foreign nationals, and that obviously would be something that would be difficult for us to accommodate in Florida, given what we're facing in South Florida. But I think that there's a relatively small number of people on those two ships who are going to need medical care in the hospital. I think the accommodations have been made, and I think that things are going to be done very thoughtfully. As the foreign nationals leave, they're going to be leaving on chartered planes. They're not going to come in contact with the general public. It's going to be a very controlled exit from these ships. And so I just want to thank everyone who was involved with that. Tough situation, but I think that they've handled it very, very well. Today, I signed an executive order on reemployment assistance. As many people know, this was a major jolt to the economy of the state of Florida. Just thinking about the scale of this, in 2019, Florida had a total of 307,701 claims for reemployment assistance. In the last 2 weeks, we've received 348,511 claims. From August of 2018 till February of 2020, the contact center took a total of 2.39 million calls. DEO has taken 2.1 million calls this week alone. So we're in a situation where this system is not handling the needs of the people of Florida in an adequate way. And so we need to do more to be able to get relief for the people of Florida. And so what I'm doing today with my executive order, and I've already had the call with all our agency heads, but I'm directing all agency heads to identify and deploy agency employees to assist DEO with their reemployment assistance efforts, including call center operations and other citizen services. We have, I think, about 25,000 state employees who are either telecommuting or non-essential and have told to stay at home. We wouldn't need all that, but we certainly could use some. And so different agency heads are already working to figure out how they could bring this manpower to bear. I think this requires all hands on deck. We have a lot of state government functions that are generally important, but just aren't as important right now given what we're dealing with. So we want to be able to utilize all the manpower that we have. I've also been in contact with AT&T and Verizon about ways we can do calling that would work well in an age of social distancing, where people could be able to do this potentially from their homes. And so this is a very, very top priority, so that people, because I think people, when you have these abrupt changes, to just be able to talk to someone on the phone or to know that you submit something and it actually goes through, obviously you want to be able to get the assistance, but if you can at least have a system where people are able to get in touch with somebody, I think that would give people a lot more peace of mind. And of course, I've also directed, as you're able to expand this, we want to work on the processing to be much quicker than it has been in the past. And so we're willing to put manpower for that as well. Because this whole web platform is overloaded, people should be able to fill out a paper application if that's an option for them. We shouldn't limit how they're able to apply, and so we're going to beef up the call centers. I've ordered them to beef up or create an alternative for online submissions. But at the end of the day, if people want to submit an application in person or drop it off, then we should be willing to accept that. So I've ordered them to make all available options available for people to be able to do that. And then I've asked, I'm ordering the Department of Economic Opportunity to immediately purchase on an emergency basis additional capacity, software, technology, and other resources as needed to ensure the state's call center, website, and staff can accommodate the increasing volumes of applications and queries. This is, I wish I could say that this is just something that's only going to last a couple weeks, but I think that this is not something that you can just turn on and off an economy like this. So we need to expand the capacity, but just understand that this is going to be a problem that could be with us more than just a couple weeks. So I think that that's going to be something that will be very much needed. So in terms of our economic priorities, this is our top priority, to be able to field the calls and be able to respond appropriately to the people of Florida. And I have all agencies now working on, and we've already just today been able to identify some pretty interesting options, and I think we're going to continue to build on that and really bring a lot of force to bear. So I told everyone, you need to be making plans and identifying people right now so that we can deploy them immediately. The other executive order I've done today relates to mortgage foreclosure and eviction relief. We're suspending foreclosures for 45 days and also suspending evictions for 45 days. I'm not sure that you're going to rent out a lot of new places right now anyways, but nevertheless, you just never know how people act. So given the circumstances, I think that those suspensions are warranted. An update on the travel. We've screened by air and car almost 11,000 people since my executive orders went into effect. And again, the folks that are coming from hot spots like New York City or New Orleans are required to self-isolate for 14 days upon entering the state of Florida. We are looking at, as you look at some of the statistics about what we're seeing with caseload here in Florida, probably the number one message from the beginning for us has been those people who are 65 and older, particularly if you have an underlying condition, you really need to be staying at home and limiting your contacts with people because of the way this virus affects those in that age group. If you look at Florida's cases, 25% of the cases are with people 65 and plus. 54% of the hospitalizations in Florida have been 65 and plus, and 86% of the fatalities have been 65 and plus. So please heed that directive to stay at home as much as possible, and please limit contact with others. We want that for everybody, but particularly in that 65 and up category or people that have serious underlying conditions. Those are the folks that are the most at risk from this disease. We are continuing to monitor the bed availability. Numbers have been pretty similar. You see little movements here or there, but most of the major areas in terms of availability percentage are in the 40% range. But obviously, we're continuing to monitor that as well. There have been some questions about my order yesterday involving essential services and essential activities, and people will say, well, can I go fly a kite? Can I do this? Can I do that? And I think the way to think about it is, when you're limiting people to essential services and essential activities, the goal is to reduce contacts with people outside the home. That is why that is in place. And so it's less important what you do than how you do it. For example, if you want to go for a 10-mile run by yourself and come back, more power to you. But you wouldn't be able to do a 20-person road race in the neighborhood with 19 of your friends. So is running an essential activity? Yes, if it's done consistent with social distancing guidelines. You could go, if you have a basketball hoop in your driveway, go shoot hoops all day. That's fine. But you're not going to be able to do a 5-on-5 pickup game where you're going to be in close contact with other people. Someone wants to take their son fishing? By all means, go do it. But you're not going to be able to get 25 people on a boat and go fishing in some type of group outing. So less important about, can you do X or Y, but simply how are you going to do X or Y? And if you're engaging in activity that doesn't involve close contact with other people, you're going to be fine. If you are doing things, even if you're staying at home, and you have 10, 15 people at the house, that's going to be close contacts with people, and that's what we're trying to avoid. So if you think about it that way, what we're trying to do is reduce the transmission of the virus. Viruses have different reproduction rates, And this is a virus that typically transmits when people are in close contact with somebody else. And so if you can refrain from that, we can reduce the transmission rate. And if you reduce the transmission rate far enough, the virus can eventually have fewer places to go. So that's what we're trying to do on that. And I know people have had a lot of questions, but just think about, if I'm engaging in essential service or I'm engaging in essential activity, am I doing it in a way that's limiting contacts? And if you are, you're probably going to be okay. If you're doing things that have a lot of contacts, then it's not going to be okay. And with that, happy to take some questions.
One of the big questions we're getting in a number of the stations is, has anybody recovered yet? Out of the 8,000 cases, is everyone still quarantined, or is it just not been long enough? What can you tell us?
No, I'm confident some have. We are not really keeping, the health isn't publishing those statistics. It's something that I've asked about, and so we are, I would like to see them publish that. Now, obviously, you got to follow people, and there's some people who will present, particularly in certain age groups, and you know that they don't require real medical care. They just need to go home and be home for 14 days. And so I don't know how much follow-up there is on those people, but I think it's a good question. The other thing that we're, what I'd like to see with the death statistics, obviously you can see it based off age, but what percentage of those fatalities involve people with significant underlying conditions? I think that would be good. I think it's a huge percentage, but that would also be, another warning sign for somebody. Even if you're not 65, if you have some of these conditions like diabetes, if you have immune system deficiencies, that this is definitely something you want to limit your contact with other people to be able to protect yourself. Yes, sir.
So, Governor, there's a lot of questions about churches and religious exemptions. Some people are curious if this still allows the mega rallies that we saw in Hillsborough County, and whether or not you're superseding them.
So, obviously, one, I don't think the government has the authority to close a church. I'm certainly not going to do that. At the same time, we got with the churches and the synagogues very early and said, in times like this, what you guys are doing, I think, is even more important. But we ask that you do it in a way that is going to be conducive to this overall mission. And I would say almost all of them 100% agree. Some have gone virtual. Some have had people, but they've been spread out far enough. I mean, you guys are spread out. Here in this press conference, there's no reason why you couldn't do a church service with people. So we definitely ask them to absolutely abide by, the social distancing guidelines. But I think that in times like this, I think the service that they're performing is going to be very important for people, especially when you have difficult circumstances. And so do it right. Make sure that you're following the mission. But I think particularly coming up in the Easter season, I think people are going to want to have access, to religious services, whether it's online, whether it's in a more socially distant type of service. But to have that available, I think, is very important.
Why didn't you announce that amended order yesterday? Obviously, there's a lot of confusion. What this amended order means?
No, look, people had questions. I didn't actually I thought it was understood, so we just said, okay, we'll clarify it and put it out there. I mean, basically, folks can, we have the baseline. If some folks want to, do things more, then they can do more in certain situations. And so we want to work with the local folks. I think each region in Florida is very distinct, and some of these things may need to be approached a little bit differently. And I'm happy to work with them about it, and we've let everyone know that from the beginning.
So it's your understanding that the court order allow local governments further and restrict perhaps those religious services?
Well, I mean, I don't know that they would have the authority, quite frankly, to close a religious. I mean, like, the Constitution doesn't get suspended here. There's got to be ways where you can accommodate. So I would tell them, work with the folks, work with the rabbis, work with the pastors, to get it right. But I think it's got to be more of a collaborative thing. But generally speaking, yeah, they can go beyond what I've done if they want to restrict access to, to certain areas. I mean, for example, we're saying you can go out for a jog, and I know there's running trails. If a local wants to just shut down the running trail, and they want to do that, then they can do it, and that's just going to be their decision.
That's not what the amended order says. It's confusion.
No, it's our intent on that is, we're obviously doing essential services. We're doing the restrictions on that. So they're not going to be able to say, oh, well, the governor says you can't have these types of contacts. We think you can have time. So what we're doing is setting a floor, and they can't go below the floor.
Governor, one of the calls that we got today, and it's not verified, but it was someone claiming that they walked into a major drugstore chain and were required to be sprayed down with Lysol, and then pay for the can. Now, what did that say about potential hysteria out there, and what would you say to people that?
Well, I mean, I would defer to the CDC, but I have no idea whether that would even be effective to do. But look, people just, I mean, we're in for a difficult time here. It's not going to be easy. We have an invisible enemy. It's definitely going to be a challenge. But I think you got to keep your cool, and I think the more people behave based on hysteria or panic, I think the harder this is going to be for everyone to come out well on the other side of it. And so, just keep calm, carry on, and let's get through this. So I haven't seen that, and I'm not sure how much sense that makes. But that's another. It actually brings up another thing about kind of the local. So, for example, the grocery stores are an essential service. So you go to Publix, Costco, wherever. If a local jurisdiction wanted to say, the grocery stores, you're obviously open, but you can only be at 25% capacity, and they want to set something up, some ways to enforce more social distancing, then they can do that, and that will be fine.
Governor, there's actually two hospitals in North Florida, Sewanee and Bradford County, that were due to be sold. They filed a warrant notices to lay off 300 about HCA. Folks out in Bradford and hospital beds and space. Doctor death there, or?
So we'll have to get back to you on that. I mean, it was something that we discussed a couple weeks ago, but just we'll follow up with you on that one.
What kind of considerations are
We're probably not going to do that. I mean, I think that, if General Lynch comes to me and says that we need to do something, I'll obviously listen to that. I've not been asked to do anything. Some of these other states have been really releasing a lot of people. Some of these people are very dangerous. I don't see how in a time of pandemic where people are on edge already, releasing felons into society, would make a whole lot of sense. I think it makes everything we're doing with social distancing more difficult. And I think as this wears on, you're going to start to see society fray a little bit more. And I think most people have hung in there, but that's just the reality. So I don't know that it would necessarily make things any better.
Governor, you've spoken to the president multiple times about limiting domestic, like a good idea, but the president, I guess.
Well, look, I think they issued the advisory from the New York City area for people to refrain from non-essential travel, and we obviously had to put in a system in place so that we're screening people who are coming in, and I've been somebody who has said we don't want to see flights from, we didn't accept flights from Wuhan starting in February. I called for that restriction early, and the president did it. I think that was a great decision. Then they did the same with Europe. So you don't want to receive flights from places that are the #1 hot zones. At the same time, I have to acknowledge that when you're talking about domestic air travel, there is a legitimate reason why you would be doing it. For example, New York City has had a lot of people fly in there to volunteer. You have different things that different folks, medical personnel. So there is a reason to have it. So I don't know that you would just not have it at all, but perhaps more restrictions in terms of out of the hot zones. But I think that there would be a need to be able to bring people into those zones if they're helping with the fight.
After those flights, you had said that a lot after New York City and November, it's shut down. A lot of flights, like Zoom, there were more flights coming in Florida. Data shows that not to be true. Actually, flights fell down.
No, that's not true at all. The week leading up to the order, they were doing 20 to 25 flights a day. You get to the end of that week, as soon as the order came down, I think it was effective last Sunday, and you saw the flights go up to I mean, they were 120, then 180. It got up to 200 direct flights a day into the state of Florida. You know, we have all those numbers on that. So what you're saying is just totally false. The flights, people were leaving New York. And doesn't it make sense that would happen? So we put in our system. You know, we are screening people, requiring them to self-isolate for 14 days. I think that was the prudent thing to do because, you know, you have a lot of people who have been sacrificed. I mean, you know, Miami has been shut down for a couple weeks. You have all these different things going on. Many people have lost jobs. Kids are out of school. Parents are stressed. So there's a lot of sacrifices going on to try to stop the spread of this thing. And how is it fair, while you're making all these sacrifices so it's not spreading, to just have more people be coming in and potentially creating more seeds, you know, with the virus? And so I think it was the right thing to do. And what we've seen since then is you have seen a reduction in traffic since we put the order in place. And I think even more than that, you know, the flights, in terms of how full they've been, I think that they've been under capacity, which again, it just makes it easier for us to be able to do the job that we're trying to do for the people of Florida without having to worry about new cases being brought in. One more.
Yeah, Governor, in my trips to the supermarkets, I see very little soup or tuna. The fresh vegetables are there. And I'm curious, are people overlooking them? Are they afraid? Are they afraid to touch them? Is it handled by someone?
Yeah, look, I think people are taking precautions. I mean, you know, it was like, you look at when all this started, and you know, there were certain things that people said you shouldn't do, but then, you know, you'd have 200 people in Costco wrestling for toilet paper. So it's just like, okay, are we trying to not have contacts or not? You know, you get people packed on the New York City subway. So so the grocery store is a necessity, and it obviously is essential because people need to subsist. But there are definitely risks in terms of that, and I think people looking and maybe not wanting, because normally, you know, you'll look at some bananas, you'll do this. That's kind of a normal thing. And I think people are probably making some pretty good decisions there because those are the types of contacts that could potentially make a difference. The one final thing I'll just say before I leave is I think we are now up to close to 80,000 tests that have been administered, and most of those are in just the last 3 weeks. We've got the new Palm Beach site up. We're working on doing another one in Boca Raton area, southern Palm Beach County. We're also going to we fortified all the existing sites. You know, I was interested in potentially doing more. Some of these areas, the demand, we were told, you know, that there wasn't enough demand to justify a new site in certain parts of the state. But to be able to get to there, if we get over 100,000, which I think we will, because we're getting 8,000, 9,000 test results back a day now. So I think we're going to be over that, get over that mark soon. That'll be 1 in every 200 people roughly in the state. That's going to give us you know, some really good information. And so you go back 2 weeks and then you start looking at everything that happens going forward. I think it really gives you a good sense of what's going on and where we may have to focus efforts you know, as we continue to fight this scourge. Thanks, everybody.